Today's topic is about angles classification. It is the classification of malocclusion. So what is malocclusion? It is the imperfect positioning of the teeth when the jaws are closed. This classification was introduced by Edward Hartley Angle in 1899. Classification is based on the anteroposterior relationship of the teeth, with the concept of key of occlusion and line of occlusion. Maxillary first molar is considered to be the key of occlusion. The three classes of malocclusion are based on the permanent first molar. Class 1, Class 2 and Class 3 are the three classes. Class 2 and Class 3 are subdivided. Next we will move on to Class 1 malocclusion. Mesiobuccal cusp of the upper permanent first molar occludes with the mesiobuccal groove of the lower permanent first molar. Class 1 bimaxillary protrusion is a condition with upper and lower anteriors are proclined and exist usually in an edge-to-edge relationship. Class 1 otherwise known as neutrocclusion. Next one is the Class 2 malocclusion. Distobuccal cusp of the upper permanent first molar occludes with the mesiobuccal groove of the lower permanent first molar. Proclined maxillary incisors and constricted maxilla can be seen in this malocclusion. Class 2 malocclusion is also known as distocclusion. Proclined maxillary anteriors. Increase in overjet are the common conditions seen in Class 2 Division 1 subdivision. In Class 2 Division 2 retroclined upper central incisors overlapped by lateral incisors can be seen. Next Class 3 malocclusion. Mesiobuccal cusp of the upper permanent first molar occludes with the interdental space between lower permanent first and second molar. Class 3 is known as mesocclusion. Class 3 is subdivided into true Class 3 and pseudo Class 3. True Class 3 is a skeletal malocclusion. Reasons for skeletal Class 3 malocclusion are retrognathic maxilla, prognathic mandible, combination of both. Pseudo Class 3 is not a true Class 3 malocclusion. These patients show normal molar relationship in rest position. This is a habitually occurring condition. Merits and demerits of angles classification. This classification is oldest system, more popular, and widely used one. Also it is easy to communicate. But it has more demerits, like this is not applicable for deciduous teeth, when first molars are missing. If you like this video, subscribe our channel.